suddenly my weight it dropped without attending. I don't want to lose weight, but suddenly this happened. If anyone work in radiation field, if anyone he did more scanning very frequently, I mean, also it will be exposed more. Unfortunately, people they feel shy, they not come to the hospital, or they said it may be normal like that. So if coming late treatment, it will take more time. This usually will be not for few days, 1 to 3 days, no, it will be for weeks actually.
Hello dear friends, good evening. Here we meet again in yet another episode of BMC Global Live Al-Hilal Health World, nothing but lifestyle. This is a talk show with the expert doctors of Al-Hilal Hospitals and medical centers. Today we will be discussing about colorectal cancer. It is one of the most common cancers found in men and women, yet many people are not aware of the signs, risk factors and how it can be prevented. To throw more light to the topic, we are delighted to have with us Dr. Umnia Mohammed from Al-Hilal Hospital, Salmabad. She is a specialist in family medicine. So Doctor, welcome to the show.
Welcome. Thank you so much. Thank you.
Thank you, Doctor, for being with us today.
Thank you.
So, Doctor, our topic is colorectal cancer. Can you briefly explain about it for us?
Yeah. And actually, this cancer, we notice that nowadays is coming more and more, not like before. Before, rarely we hear someone has cancer, but nowadays more common. Maybe because lifestyle change, maybe also because of the detection technique, it's becoming more advanced. Could be that reasons also.
So, Doctor, what age group is more prone to this colorectal cancer?
Okay, actually, colorectal cancer can happen at any age, but most commonly it will be above 50 years of old. But even nowadays, also we notice that young people also can be affected with colorectal cancer. It's still a cause unclear why this happened. It's still we don't know that.
Now, can you speak about the causes of this type of cancer?
Okay, actually the causes, it will not be single cause, but it will be, generally we said it's unknown causes, but there is some factors it will attribute it in colorectal cancer more, like genetic predisposing, family history. If we have family history, if fathers, brothers have colon cancer or colorectal cancer also, this will be prone us more for colorectal cancer. And also it is exposure to radiation. If anyone work in radiation field, if anyone he did more scanning very frequently, I mean, also it will be exposed more, and also exposed to the chemical and carcinogenous substance. And this actually it will be broad, because nowadays a lot of toxin environment become more toxin. Actually we deal more with the plastic. Also plastic it produce chemical substance. It's also harming, and actually harmful from the plastic and that environment. It will be not one time, it will be over long period this happen. When it started we don't know, and for how long, and how we can measure that toxin. Usually we in daily life we are not caring about that, and we exposed to that with a chemical toxin daily. Maybe in our daily routine we expose without knowing. So this also is prone us also for more affection by the colon cancer. Besides that, actually some people also are sick. They have inflammatory bowel disease, which is inflammation in the bowel. It make the bowel like will be inflamed, and will have actually inflammatory bowel disease. Even here in Bahrain is common actually, like Crohn's disease and ulcerative colitis. This also it's prone to colon cancer. So also this patient need to like regular checkup for that type of cancer. Especially patient which have chronic constipation also need to evaluate it, because also at the end it can also lead to colon cancer. Okay, so as I said, generally in the brief, it is not single cause, but several factors can affect that. At the end, there is a DNA in the cell of that our intestine. It will be replicate rapidly without controlling. So that is a cancer, is a proliferation of the cells randomly without control. That at the end it gives cancer actually.
Is there any connection between the food habits and this type of cancer?
Yes, of course, actually, because food high in fiber, it will be good for us, like fruits, vegetables. This is very nice. At the other side, if we eat food like more fat, more rich in fat, more even red meat, better not eating more, because also red meat it's prone to increase the risk for colon cancer. So healthy lifestyle is the cornerstone actually. Not only for this colon cancer, for many other conditions. Yeah, it's a healthy lifestyle is very important. So need to be careful about the food, eat healthy food as much as we can.
Now, doctor, what are the symptoms we should look forward to in this type of cancer?
Actually, symptoms generally it will be like alternate in the bowel habits, like sometimes lose motion, sometimes have constipation, and this usually will be not for few days, 1, 2, 3 days. No, it will be for weeks actually, and also weight loss unexplained. I don't want to suddenly my weight it drop without attending. I don't want to lose weight, but suddenly this happen. So I need to also to visit doctor to see why this happened for me. Another symptoms also unexplained anemia. If have anemia for a long time, especially iron deficiency anemia, I need to know why this happened for me, especially if I am already not have been anemic. It coming late for me, especially see example, one lady after 50 years old, suddenly she have anemia, before have no. So I need to investigate thoroughly why this happened for her, not just only to treat anemia. I give iron supplement, go and take this one. No, I need to know why, what happened, what cause of that anemia, because anemia also it can be symptoms for the colorectal cancer. And also some abdominal pain, discomfort, and also some people can feel mass. They feel some lump in their tummy. They don't know what happened. So also, and this could be the cause of the symptoms of the colon cancer. Besides that, actually, and the very important rectal bleeding. So this rectal bleeding from the blood from down or stool mixed with the blood. Actually, this may be the common presentation. Unfortunately, people they feel shy, they not come to the hospital, or they said it may be normal like that. It will coming late, unfortunately. So if coming late, this also affect in the detection and also the treatment. It will take more time. So we need to aware about these symptoms that I mentioned. This general, of course, maybe more symptoms like loss of appetite. I feel I don't want to eat more, like that. This could be, but this is the main symptoms for colorectal cancer that I mentioned earlier.
So these are the symptoms. So if a person presents with these symptoms and they come to you, what are the tests you do to diagnose colorectal cancer?
Okay, actually, if have symptoms already and he came, generally I will do blood test for him. For general, I will check his hemoglobin, for example. If I found anemic, as I said, I will go for further assessment. Then I will do actually there is a test. I will test for a stool test. Actually, for occult blood. Actually, because sometimes there is bleeding happen through the rectum and it goes with the stool, but we cannot see by the eye, only under microscope. Yeah, this is called occult blood. That blood we cannot see clearly. So we'll do that test. Okay, this test actually, if coming positive, then we will go for further assessment, deep assessment. Actually, we will do colonoscopy, which we introduce tube with a camera inside the colon to see clearly the wall inside, if any bleeding, and sometimes we found polyps. Actually, polyps is overgrowth of the cell inside the colon. Actually, this polyps not always is going for colon cancer, but these polyps need follow up. If we found, we can remove it. Okay, because some polyps, not all, some polyps it can be precancerous. So that Colonoscopy, as I mentioned, is also we use as investigation for colorectal cancer. Besides that, imaging also we will do like CT scan, MRI, magnetic resonance imaging will do also, and also there is some blood tests. But not all type of colon cancer can be CAA. This it will be marker for the affected cells. Some type of colon cancer, we found this level it will be high. Okay, so the main gold standing, the treatment and investigation, investigation, and even for screening, this later we'll talk, also we use is the stool test, and is the cheaper, and even in the government, actually in Bahrain here, they doing freely in the medical health center, this screening test, okay, will be. And it will be not invasive, no need to take blood sample. Only we'll give a stool sample, and we will see the result, follow the result according to the result, as I mentioned before.
Okay. Now, once diagnosed with this type of cancer, what are the treatment options?
Yeah, actually, treatment option will be like surgery, because at the end there is a swelling, there is a tumor, so we need to remove the swelling outside. So definitely will be surgery. Will happen, many need it, and actually sometime open surgery. But if we detect early, surgery may be endoscopy, so need even for open surgery for to open the abdomen. And also after that, maybe or before, we need radiation, okay, and chemotherapy also. It is other modalities of the treatment. It depends on the stage of the cancer and the age of the patient, comorbidities of the patient itself, like that will be.
Another common query is this type of cancer preventable?
It can be preventable. It can be prevented actually, generally by prevention will be by the control the risk factor as much as we can. Try to control average weight, okay, and eat healthy food, as more fruits, more vegetables, need more fibers intake, and to reduce fat intake, and red meat also better to reduce use of red meat, and also exercise regularly, because exercise is very, very, very good. Actually, if you do exercise at least daily or for 5 days per week, 30 minutes 5 days a week, it will be very nice. 30 minutes, no need to go for a gym like that. Even walking 30 minutes daily will be very nice, not only for the cancer, for anything, for other disease also, even for the mood, for many conditions. Exercise is very good, and better to be maintained, not one day exercise and we stop. No, it will be better to be as habit for us. And also smoking, if it's smoking, better to stop smoking. Actually, quitting smoking at any age, it's okay. I will not say no, it is late for me already, whatever happened for me, I will not stop smoking. No, at any age, if you stop smoking, so your body will get benefit of it for this, not only for the lung cancer, actually even for other cancer and for other health condition. Quitting smoking is a good. So by this one, we will prevent as much as we can as this like acquired causes. If coming genetic or family history, of course it cannot be prevented.
Doctor, when it comes to cancer, early detection can make a huge difference. So can you explain about the screening and early detection?
Okay, yeah, actually screening, it will be through, we'll do stool test. It's called FIT test. It is fecal immuno test, okay. Actually, this test introduced in Bahrain, and Bahrain they make campings for colorectal cancer awareness, because actually, as we mentioned earlier, colorectal cancer is the commonest here. It is the second causes. So screening, early detection, it will help not only to prevent from the beginning. We will prevent not happen. How to prevent this one? Actually, this we'll come later for that one, okay. But first I will talk about that FIT test. FIT test, actually, just it is a simple test, non-invasive test. No need to take blood sample, just only stool test. Actually, we will test for the occult blood coming from inflamed colon, bleeding colon, maybe small blood we cannot see, but with the fit test it can detect it. Once it coming positive, then patient will be referred to do colonoscopy. In the colonoscopy, actually, we will do, and even if found polyps, I mentioned earlier that one. Polyps, actually, if we found polyps, we will remove the polyps. If we remove the polyp, even if patient not develop colon cancer, with the time, maybe these polyps, it will change to cancerous. So if we remove early, by this way also, we will do prevention in that case. And even unfortunately, if we discover after colonoscopy patient had colon cancer, if we detect at early stage, this will make major difference for the patient, for the country itself, because cancer treatment is more expensive. Actually, here in Bahrain also we have more facilities, many specialized centers like King Hamad Oncology Center. In Salmania also there is a center, BDF, also there is a oncology center also. So early detection, it will gold standard for early screening. It's a good early screening. I mean, it is a good for early detection of the disease, and also prevention. Prevention, as I mentioned, if we found polyps already, we will remove that one. Okay, so that test is easy. Anyone if feeling any that symptoms we talked earlier, just simply can go to the health center and ask for this fit test. They will offer for him immediately.
Finally, doctor, what is your advice for our viewers?
Thank you so much for giving me this chance for me today here. Actually, as we said, prevention is better than cure. And early symptoms, whatever you have, better to go for the medical checkup. Go for the doctor to telling about your symptoms. Even if you found it is a simple thing that not bothering you, but especially that the main symptoms that we mentioned here for the colon cancer, I will mention again briefly, like if have any abdominal pain, unexplained weight loss, unexplained anemia happen, alternate in the bowel habits for you, any rectal bleeding, especially rectal bleeding, because mostly people will come late. They found shame to go to the doctor. No, you can come at any time for the doctor, because you are not the first one. Actually, doctors is dealing with the many conditions. So whatever you feel any symptoms, better to go early. Early detection is the gold standard, and also healthy lifestyle is the must. Is the major cornerstone. Actually, being healthy, eating healthy food, average weight is very important, because nowadays actually fast food becoming problem. Most of us is easy to get fast food. Fast food once in a month, like that one in a blue moon, okay. But the problem, if becoming habit, this problem, because fast food really saturated. It is full of saturated fat, less fiber, as we mentioned. So it is at the end it will go for not only that colon cancer. It will bring us to the diabetes, to the obesity, and heart issue, a lot of issue. Exercise also very important. In the beginning, simple things, it has a major role actually, and it will make better change in our life. Just need to adopt healthy lifestyle.
And doctor, what are the services you offer in your branch, Salmabad of Al-Hilal?
Okay, actually, yeah, there we are providing a lot of services, especially for this colon cancer patient. We have general checkup, blood checkup, actually, because we need to check for the anemia, and also general, like for the kidney test, for the liver test, and we'll see, and even blood test that I mentioned earlier, CAE also will be done in our branches, and also stool for occult blood also we have that test. And if patient need colonoscopy, also we have, but not in our branch. Just we refer patient for our hospital, Premier Hospital, or Al-Hilal Muharraq Hospital. Also they help, they do for him all this.
Okay, thank you, doctor.
Thank you.
Thank you once again.
Thank you so much. Thank you. Nice to see you.
So viewers, as doctor said, when it comes to cancer, early detection plays a huge role in recovery and survival. I hope this episode was helpful for you. For more informative episodes, tune into BMC Global Live Al-Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jessila Mujib signing off. Good night.